Good morning, everyone. Happy St. Patrick's Day, all of that stuff. And it's not such a happy St. Patrick's Day if you're a business that relies on St. Patrick's Day and, well, everything's closed. That's not so good. Subdued St. Patrick's Day expected as BC pubs ordered to stop selling liquor at 8 p.m. So BC is not as locked down as Ontario. Ontario is very, very locked down. Here's a report out of Ontario. Joe Warmington from the Toronto Sun says maybe next year Toronto's Irish pubs shut for St. Patrick's Day. And shutting down for St. Patrick's Day last year was difficult, but to have it happen for a second year is a disaster, said Pat Quinn Jr. at PJ O'Brien's pub on Colburn Street. But that's what the COVID-19 pandemic has done to local businesses. It's destroying them, and we'll have more on that later. For all pubs and restaurants, it has been a nightmare, said Quinn. I feel badly, mostly for my staff. They've had it rough. On March 16th, 2020, when word came down that fears of coronavirus spread made it too dangerous to open up for St. Patrick's Day, Quinn never dreamed it would happen again. We thought it would only last for a couple of weeks, said Quinn. They shut down the pub and waited it out. They're still waiting. With no patio, they were not able to salvage a summer season, but were hopeful things would get better and that they would be able to open again. Now they're worried, or now they wonder just when they will get their chance. Quote, we really feel it has to open soon, said Quinn. Getting as many people vaccinated as possible is a positive, but we think businesses like ours can do our part to social distance and sanitize things to keep people safe. The extreme lockdown in Toronto is putting pubs like this at risk of shutting down forever. We were planning on to come back, but if we're honest, it's very difficult to manage things when there is no revenue, he said. We need to find a way to open up and learn to live with this virus so we can get back in business again. Yeah, if you don't have revenue, you've got bills, you don't have a business, right? You may own a restaurant, but if nothing happens when you go to the store, pick up product, which is food, they sell food, and then can't sell it, well, you don't make any money, right? You just have bills, and that's not so good. York's medical officer of health getting into third wave. Sorry about this GIF; it's driving me crazy. It's not. I don't think it's going to help doing what I just did. Anyway, regardless, York's medical officer of health, Dr. Karim Kurji, sorry if I got that wrong, says he disagrees with Anthony Dale, OHA, that's the Ontario Hospital Association president, and Science Table that Ontario is in a third wave of COVID-19. Quote, my sense is that they're not going to be explosive in terms of the growth, he says, of variants. So third wave. Millhouse says the new pandemic declared by Toronto's EP de Villa over a month ago and exists nowhere else in North America is marked by a modest increase in cases concurrent with a continued decline in deaths and hospitalizations, yet it will be used to further crush people's lives. Yeah, see the opening story off the top, right? Happy St. Patrick's Day, unless you're an Irish pub in Toronto. Kulvinder, Dr. Gill, says governments refuse to provide an objective quantitative definition for pandemic, but insist on imposing abusive, unscientific, and unconstitutional lockdowns and restrictions, causing horrific harms until they deem said pandemic is over. Meanwhile, life is normal in many other jurisdictions. And Dr. Gill is saying, 18 states in the U.S. alone and growing, how do governments explain the existence of jurisdictions that ended lockdown restrictions even prior to the approval of any COVID vaccine? How does the government explain the existence of normal life with COVID, but without masks, mass asymptomatic testing, and mass vaccination? I don't think they can explain this. I don't think they're going to engage with it. Not at all. And I'll show you the response I got from my local health council or the health board for my delegation on March 3rd. I'll show you that. And I'll show you some other people who are expressing concern about the information they're getting from their public health. We looked at Ottawa's yesterday, but we'll look at that again today. But here's... do you enjoy wasting millions of dollars on a failed app? Investing in a failed app that even with an advertising push, nobody downloaded. How much did we invest in these vaccines? What's the uptake on the vaccination? Like, how many of them are going to be used, right? Like, anyway, here's the global news story. It says global news statistics suggest so few people are using the app correctly that it has almost no effect on slowing or limiting the spread of COVID-19. I mean, it's always appropriate right here. I should move that up on my soundboard. I use it far too often. But it's such a waste of money, right? It's such a waste of money, and there's no use for that. There's no good explanation for that. And you can't replace an economy with government picking and choosing who they're going to give $10 million. Oh, don't worry, we'll get jobs. You want jobs? We got 100 jobs. There you go. There's $10 million. Do something with that. Government can just print money. Boom, here's some jobs. You want jobs? Bam. Problem solved. What else do you want? Cheap food? Problem. Go to McDonald's. Dan Kelly says, I'll leave it to others to determine whether we are in near a third wave of COVID-19. Regardless, we cannot return to shutting down the economy to address the concern. Lockdowns were meant to buy a bit of time to ramp up healthcare capacity, not a semi-permanent policy. Forget semi-permanent. It's permanent. Gyms, indoor restaurant dining in Toronto, for example, have been locked down for nearly 300 days and still remain entirely closed. Has this been an effective COVID mitigation effort? Good question, Dan. Good question. Where were you months ago asking this? Why haven't you been pushing this for months, Dan? Back to Dan. We have vaccinated many of the most vulnerable and are finally making progress in vaccinating older Canadians. This is expected to help address concerns with healthcare capacity and fatalities, the entire goal of the lockdown in the first place. Small businesses have done more than their fair share in the COVID battle. It is well past time to use other policy interventions, including rapid testing and expanded contact tracing, to address any interim problems before vaccines ramp up. Ooh, no. Dan, we've got lots of evidence of places all over the world that have opened without all of that garbage, and we don't need to do it here, Dan. Start looking at the data, sir. Back to this. We simply cannot look backwards and return to shuttering small businesses to get us through the next few months. Instead, we need to allow small businesses to reopen with an escalating percentage capacity to ensure Canadians have jobs to return to when this is all finally over. CFIB has projected that there will be an additional 180,000 permanent small business closures due to COVID restrictions in the months ahead. This assumes the economy steadily reopens and not the opposite. That's a lot of businesses. That's a lot of people that are being impacted by these bad policies. And they are bad policies that are driving this. It's not COVID. It's bad policies. Because we have examples of places that are open despite no vaccines and despite COVID existing. And as we know, the virus does not respect borders. It's everywhere. If it's anywhere, it's everywhere, right? In the UK, they're threatening now variants of concern, and they stopped calling it the UK concern because, as I'll point out right now, the UK isn't concerned about the UK variant. The UK is concerned about the Philippines variant, right? The killer from Manila. This is the Daily Mail. The Killer from Manila. And that's a throwback from the Thriller from Manila, where Muhammad Ali fought, I think, Foreman, because he lost his boxing license in Las Vegas or something, because he was dodging the draft, I think. A little fuzzy on my history there. But anyway, they had a boxing match, and they're using that boxing match now to propagandize for a variant of COVID-19 to scare people into compliance. Weird. I mean, weird. I was talking with somebody today, and they said they were telling me that they grew up in a place that had communism, and he couldn't believe what he was seeing. And I think it was a he anyway. And I said I grew up in Canada in the 1980s, and this place isn't that place, and this place more closely resembles V for Vendetta, like things I've seen in movies. And I've been alluding to this a long time. I've been talking about it. It seemed like at first it was a graphic novel, right? Where the dystopian headlines just kept coming, and you were like, man, this can't be what they're focused on. This can't be the problem that they're really like, we've got to get the Batman, right? Like, oh no, racism is the worst scourge in Western society. White supremacy will take over. This can't be real, right? And now it's jumped into 3D. Like, we're into a full-blown movie. This is V for Vendetta, man. This is like, go watch V for Vendetta. Right? When Evie goes out in the evening and they've got the loudspeakers, and then turn on the Quebec loudspeakers, you are at a rally, you must wear a face covering. It's unbelievable. It's unbelievable. We are in the movie. It has manifested itself around us. We've created this reality. And that's on us. That's on us. We've done this. We've let it happen. Somebody else makes that argument. I'll read it in a few minutes. But it's scary, right? And now they're using movies from the early 2000s to continue... Ali, right? To continue their fear mongering. Here is Doug Ford moving into, you have to listen to your medical officer of health, moving into the follow-up from my delegation on the 3rd, and we'll go through that. But here's Doug Ford, and he says, I'll give it to you straight, man. I'll give it to you straight. This is what's happening, because if you ignore the medical officer of health, put a rope around your neck, you're done politically.
I'm going to stick with what I've done right from the beginning. I'm going to stick with health and science, and work with them collaboratively. But I'm going to be very frank. There's no politician in this country who's going to disagree with their chief medical officer. They just aren't going to do it. They might as well throw a rope around their neck and jump off a bridge. They're done. I'm telling you the facts. It's very simple.
Isn't that weird imagery? when people are talking a lot about like self-harm and all of that stuff. You know what's weird too, and this is a total weird aside, the imagery Doug Ford evokes there is, I don't think appropriate for the context and the times we're in. Okay, now to tell you what's weird, I was watching The Incredibles the other day, and The Incredibles is like a pretty good Disney movie. 2004 came out. Okay, and I used to work with kids, and when you work in a group home, there's a lot of movies, right? And The Incredibles came out then, and I never noticed this then. I think I would have remembered noticing this. I noticed this 6 months ago, certainly during the pandemic, probably. But at the beginning, the whole premise for the superheroes going away in The Incredibles is Mr. Incredible saved somebody who was committing suicide, who was jumping off a building, right? He saved somebody, and the guy's got a neck brace on. He's like, "You didn't save my life, you ruined my death." And I thought that was a funny line, and I laughed about it. And I went, ha. And then I thought about it, and I thought, what the heck is this doing in a kid's movie? It's The Incredibles. The whole premise for the superheroes being removed from society is that Mr. Incredible prevented somebody from committing suicide, and Mr. Incredible is sued for that? Sorry, the Mr. Incredible Disney aside, I know what Disney is. I know. I don't know why. Like, there are certain things that Disney's a whole rabbit hole that I can't get into right now because I'll be so derailed. But really, if you didn't know that, go watch The Incredibles. Watch for that line. It flies right by. It flies right by. And the whole empowerment of Elastigirl at the beginning, right? I don't think so. Okay, moving forward. So Doug Ford's evoking suicidal people who would ignore their medical officer of health, right? Mr. Incredible, if he saved that guy. Oh, okay, no, I can't make that connection. That joke wasn't very good. Okay. Winston Smith says, Ottawa update, there's no intention to end mask mandates in Ottawa. We are officially chasing 0 cases. Even with mass vaccinations, we will still be wearing masks. Masks are your new normal. And I said this yesterday, I went in depth about this yesterday because this is what I was looking for from the Wellington Dufferin Guelph Health Unit. Because now we have something to negotiate with. Now we have a starting point. Now we can say, this is your position. How do you back this position up? Back it up. But citizens shouldn't be debating with the medical health officer. The job of the debate is for the elected officials. It's not for people like me to get into debates, and I'll show you in the next one, with the medical officers of health. It's not up for people like Winston to get into debates with the medical officers of health, trying to say, why are you doing this to us? Why are you destroying our businesses? Why are you destroying our city? Why are you destroying our province? Why are you destroying our lives? We can see other places are open, and they try and justify it by vague, we're close to capacity and blah, 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 blah. They try and justify it in very strange ways. But fundamentally, this is all upside down and backwards. All upside down and backward. The people who should be representing us, the elected officials, aren't representing us. They're representing something else. I don't know what that is, and I don't know what the official deals are or anything to that effect. But there are not people who want what is happening. There are not mass amounts of people who are fully on board with the full destruction of our society and replacement of the culture to wear masks and the replacement of the culture to stay in their houses forever and never play with their friends and never see their family. People are not okay with this. And further, I don't know if I went through this. I don't remember going through this, but Ottawa Public Health states the disadvantages, which are numerous. I was looking for this too from the Guelph and Wellington Dufferin Public Health. You have to be able to give informed consent. And so far, on everything I've seen regarding mandating masks to kids, nobody's mentioned the potential drawbacks to prolonged masking. Nobody's mentioned the fact that there hasn't been any studies on prolonged masking of children with regards to the still face experiment, with regards to Milgram to a lesser degree, because Milgram is just an experiment about compliance, and the abuse is secondary. But man, if there are some PhD students who are in psychology, this is an ongoing experiment with data that you're going to want to look at. But there has been no studies on what the impact is on children for prolonged masking, for increased infection of bacterial pneumonia or impetigo of the face or lesions or acne. There isn't an easy to digest ad or 30-second YouTube ad or pop-ups or anything that they're talking about. If you wear a mask for prolonged periods of time, these are the issues that you may face. And here's the Ottawa Public Health's potential harms and disadvantages. It says the likely disadvantages of the use of masks by healthy people in the general public include potential increase of risk of self-contamination due to the manipulation of a face mask and subsequent touching of eyes with contaminated hands, right? Potential self-contamination that can occur if non-medical masks are not changed when wet or soiled. This can create favorable conditions for microorganisms to amplify. At least there, people are informed. You can say, do you consent to this? Is this what you want? Potential headache and or breathing difficulties depending on the type of mask used. Potential development of facial skin lesions, irritant dermatitis or worsening acne when used frequently for long hours. Difficulty with communicating clearly. Potential discomfort. A false sense of security leading to potentially lower adherence to other critical preventative measures such as physical distancing and hand hygiene. Poor compliance with mask wearing, in particular by young children. Young children shouldn't be complying with mask wearing. Waste management issues, improper mask disposal leading to increased litter in public places, risk of contamination to the street cleaners, and environmental hazard. Difficulty communicating for deaf persons who rely on lip reading. Disadvantages for or difficulty wearing, especially for children, developmentally challenged people, those with mental illness, elderly persons with cognitive impairment, those with asthma or chronic respiratory or breathing problems, those who have had facial trauma or received oral. I'm not going to try that. And for those living in hot and humid environments, or anybody who just wants to breathe clearly and knows that the risk of wearing the mask outweighs the risk of COVID. So that's what the medical officer of health of Ottawa says. Here's the response from Guelph, and they don't really address my issues, and I think that it's unfortunate because I just want the issues dealt with head on, right? And they kind of dodge. Well, they definitely dodge. And that's, I'm not really expecting more than a dodge because I don't know that I was expecting a response at all. I was expecting to be ignored. I thought I was ignored. I sent an email to ask about delegating in April, and I didn't hear back. And I was like, well, I don't know what the turnaround time is here. 3 days, 5 days, what it is. So I sent an email last week, and then I sent a follow-up this week, and I heard back this week, so I'm scheduled. But I asked a lot in my initial delegation, and my initial letter was 30 pages long, and it had compiled data of other places that have opened with no vaccines and no mandatory masks, et cetera, and showed no excess deaths. And there's a whole bunch to it. You can see everything if you're interested in seeing everything hold on, I'll bring up the website so you can see it. So it's here. You can look at the original letter I sent. The delegation where I spoke on March 3rd, and I'm 2 minutes into the YouTube video. You can watch the whole meeting if you want, and then the response from the public health on March 16th. So it's good that I got a response. I'm glad that I got a response. But I asked for some specific data, and they said no. So I'll be submitting freedom of information requests for the data that I asked for to make sure that. To make sure that I get that. But you can read the whole letter here. I'm not going to go through it. I think that there's no point in going through it. I think it's funny that they say, while it's not our intent or role to get into a back and forth debate with you regarding the weight to be given to various articles and social media posts that you are citing, we do note that the article concerning the German study regarding the psychological effects of mask wearing has the following editorial comment. So we're not going to debate with you, but if we were to debate with you, this is what we'd say. So I think that that's funny. And they say that the study is based on a survey regarding the adverse effects of mask wearing in children. Due to multiple limitations, this study cannot demonstrate a causal relationship between mask wearing and the reported adverse effects in children. Right. So the point was, though, that I submitted a lot of different compelling arguments. It wasn't to focus on a single argument, which was the reason why my submission was so long, but that's okay. I'll try again, and I'll be more concise this time. I think I'm thinking my strategy through. But fundamentally, I asked for a lot of data, and they said, we're not going to give you data. We don't have the mandate or resources to execute the type of studies you're referring to in your email, but they rely on provincial and national evidence-based medical guidance while also aligning ourselves with what we consider to be the present scientific consensus regarding best practices for reducing the risk to the community arising as a result of the COVID-19 pandemic. I had asked about what exact metrics are we using to move our city into different levels, and that was the answer. So you see, they're not trying to answer the question, they're trying to get me to stop asking. So I'm going to continue asking and highlighting their lack of answers, because it's important. because it shouldn't be me debating these people. They're exactly right. It shouldn't be. It should be leadership making decisions. It should be Mercer, Dr. Mercer, and the other medical health people advising the politicians, and the politicians making the decisions and being held accountable. And I would be just fine to stop interacting with the public health if they were transparent about their data, because then I could take it to the politicians, but they're not transparent about their data, and they don't want to be transparent about their data, and that's a problem. Okay. And that's one problem, one of the many problems. Here is Ray, and he says, I'm getting similarly stonewalled in York region by Miss Mulrooney and the medical officer of health there, presumably. And so it's not just me, it's Ottawa and it's other places in Ontario. Here's Jason Kenney. Jason Kenney's doing the same thing. He says, Dr. Dennis Maudry wrote me an open letter posing several questions on COVID-19 policy and calling for an end to all public health measures. While I appreciate the ongoing debate on pandemic policy, it must be based on facts. Below is my response with answers to his questions. So Kenney answers the letter, and I'm not going to go through the letter that he goes through here. He talks about, he says, your assertion, I'll go through some of it. He says, your assertion that we're nowhere close to the capacity of our healthcare system is demonstrably false. The 8,500 staffed hospital beds and 272 staffed ICU beds you cited are needed for all Albertans, not just patients with COVID-19. To assume that we could fill 100% of these beds with COVID-19 patients ignores the fact that people need health care for many other reasons. The province's surge capacity of 1,081 staffed ICU beds is reserved for worst case scenario. It can only be achieved by delaying or canceling scheduled and urgent surgeries. Such an outcome would have to have severe implications for the broader health of society. So he's trying to base this in numbers, but I don't think that he stays there. The questions are pretty good ones, but Kenney knocks them down pretty easily, I guess. Question one, have you evaluated what percentage of patients hospitalized with COVID-19 are actually in hospital because of COVID-19 as opposed to with COVID-19, wherein it is the underlying disease that is the actual reason for the admission? He says here that only 11% of COVID-19 hospitalizations were within a hospital setting. So in the States, what was happening is people in the hospital were getting COVID, and that was inflating their numbers. But it seems that Jason Kenney has numbers to say, no, that wasn't happening here. Number two, have you evaluated the percentage of patients who died with but not from COVID-19? In Alberta, we report the number of deaths caused by COVID-19. Each death reported to Alberta Health is assessed to determine if there was an unrelated cause of death or if the death was caused by COVID-19. Deaths which were caused by COVID-19 are removed, which were not caused by COVID-19 are removed from the government of Alberta's reported figures. I still think that's a little bit muddy. Caused by, like, what's the criteria for that? Like, and how does it kill? Like, is this the same? And does Alberta have the same number of COVID deaths? See, that's the problem with debating this way. Like, if you've got data like that knocks away a question because you can tell where the question's going, then you have to come back with, okay, what are the comparable numbers, 5-year average for flu deaths? Is Alberta in line with flu deaths? Is this just a replacement flu, or are we high for that? If we're high for that, are we low in other places by the same metric, right? Like, are we low cancer deaths instead now COVID-19, right? But the total is the same. There's so much to unpack with just that one question. The debate doesn't work one way. And often a politician will write a letter like this and say, that's done. I'm not going to engage with that guy anymore. I've answered his questions. Done. But there's so much to peel back. It's like an onion, right? Ogres, onions. Okay. Number three, are you aware that the PCR test for COVID-19 has had a false positive rate of up to 50% according to the CDC and up to 90% according to other sources? He says, I am aware of that. I am aware of concerns surrounding PCR testing and have investigated whether or not false positives are an issue in Alberta. We've investigated ourselves. Don't worry. The Wee brothers, us, we all investigated ourselves. Above board, everyone. AstraZeneca too, they investigated themselves. They found themselves totally legit. No problems. Number four, are you aware of how many people have died or become seriously compromised because they could not access healthcare for non-COVID-19 diseases, including treatments for heart disease, cancer, and other life-threatening problems? Unfortunately, the specific data you request is unavailable. It should be noted, however, that based on Statistics Canada's surveillance due to overall age-adjusted death rate in Alberta from January to early October is not significantly different than expected death rate in 2020. So that's weird, right? He's admitting that there's not excess deaths and saying, like, he says, to be frank, on this point, I believe you're arguing against yourself. You've assumed that we can push out all patients to make way for an influx of patients with COVID-19, but now you're raising concerns about a loss of non-COVID related healthcare, while it's the overwhelming of our healthcare system with COVID-19 patients that would result in the most substantial loss to medical services. It's interesting that the problem is Kenny's saying we could overwhelm the system, but we have data that shows places that are open that are normal. And if overwhelming the system means above 85%, then maybe. But if overwhelming the system means operating in the same average as we have for the last 5 years, no, I don't think that that's possible, because looking at the other jurisdictions that are open, there's not any reason to believe that. The only reason to believe that is the models. So Kenny's saying if we open fully, we're going to have the ICUs full of COVID patients, and that's going to create no room for all the other patients that we need to serve, and we need to serve them. So we have to stay with these restrictions because these restrictions have a balance of COVID patients and having the other patients served. But again, this is one of those things where you have to peel it back, and you have to have the conversation, because there's so much more to it than just what he's putting forward, right? And it's like, how do you facilitate that when all the leadership and the federal and the provincial leadership are on the same page, and the page is we have, in order to keep them safe, we have to destroy everything, because that's what it feels like we're on. Number 5, are you aware of how many people have committed suicide due to government-imposed lockdowns and shuttering of businesses, schools, colleges, and universities? He says there's been a reduction in 10% in suicides for the year. Hold on, let me see exactly what he says. He says, thankfully, our preliminary data suggests that the suicide deaths in 2020 were 10% lower than the previous 5-year average. Interesting. I wonder if that's national. Like, which data? I'd love to see the data cited. Number 6, do you believe it's ethically and morally appropriate for government to pick winners and losers by defining what is essentially essential service versus not essential business? They repealed that apparently in Alberta. He says, I don't believe it is right to make a distinction between essential and non-essential businesses, and it is no longer part of our government's policy response. The reality is that every business is essential to the people who own it and the employees that work there. 7, are you fully aware of the magnitude of the economic devastation Alberta has sustained and that are spiraling down rapidly to a have-not province? Kenny says, obviously I'm aware of the current economic devastation in Alberta. I thought that was kind of funny. 8, are you aware of how many divorces have occurred consequent to the lockdowns and loss of income? What about the increase in domestic abuse, family violence, and increase of substance abuse? Here's information we have available, and he outlines that. Are you aware of the short and long-term effects of restrictions on mental health and most vulnerable? Have you been appraised of, number 10, have you been appraised of how much crime has increased due to people becoming desperate just to stay alive? And 11, in the interest of transparency, please provide the information highlighted above to all Albertans on a daily or weekly basis on the AHS website, various social and other media, so that the people of Alberta can work with you rather than question the validity of imposed interventions that are no longer required. I think that underlines that people are done, and that politicians are going to just give you the canned response, because it seems like Canadians will take it. That's what it seems. My son does this all the time. He was telling us something during dinner time, and he had his hand out, and he was like, no. And he started talking, and he started using his hand like that. I was like, oh my goodness, that's me. Anyway, sorry, it was very funny because I noticed it, and I just noticed my hand doing it, and I thought, that's me. Anyway, I apologize. Quick aside. Anyway, Amy Greer, Lisa says, Amy advocates for more testing. Parent responds with this traumatic response. Parents need to stop testing your kids. Amy Greer is a Guelph. She's the chair of the University of Guelph infectious disease epidemiologist and mathematical modeler. So she became very important in January 2020 when they started using these medical models to lock down and remove our rights. And this happened. They were talking, and she says, we were sent an email by our board with a link to the testing locations at different schools. My 6-year-old has had one NP, that's the nasal swab test, and there is no way I could convince her to do that again. I had to hold her down with my legs and arms to allow the nurse to do her job. Ugh, I'm so sorry. That is horrible, says Amy Greer. She's advocating for more testing of kids, though. Here's the thread where she's advocating for more testing of kids. And the problem here is, why would you do that to your child? You're not sick. You're not displaying any kind of symptoms, or maybe one symptom. We'll see how things go. If you look like you need extra help, then maybe we'll talk about it. But at this point in time, looking at all the data of all the kids who have had this illness in Ontario and Canada, it looks like you'll probably be just fine, kiddo. Buck up. No, I'm not going to take you for a test and hold you down and let the nurse do that to you. No way. Stand up for your kids. Come on, don't do this to them. My goodness, what an awful thing. What an awful thing. Terrible, awful thing. Okay, Amy Greer, the modeling expert, says a short thread. This woman is the same woman who was questioning continuing to take cold showers because her hot water tank had stopped working and they didn't want the people inside the house. She couldn't figure out that if maybe she didn't want to share the same space, she'd just leave the house. That's no problem. But she said, we haven't had people in our house since March of 2020. How are we going to do this? Oh my goodness, I can't solve this problem. These are the people who are making decisions for us, it seems. Okay, a short thread about asymptomatic testing of Ontario students and school staff, my opinion. We're not doing enough tests, and we're not communicating clearly the reason for testing. We are not necessarily using less invasive tests, and we are certainly not making it easier for families. The goal of asymptomatic testing in the education sector is to help to further reduce the risk of school introductions, which may lead to in-school transmission events. Where are the in-school transmission events? They tested 1,000 kids and found a 0.5% positivity rate, which is in the margin of error, I'll tell you. Well within the margin of error. Actually, I'm surprised it's not higher positives just for the false positive rate. We are currently using a higher symptomatic testing threshold, test when only one symptom, even if it's minor, which is great. We test more symptomatic kids, find positives, and prevent school introductions and or dismiss exposed cohorts. But we know some kids will not have obvious symptoms, so asymptomatic screenings help us to find kids and staff who may not know they're infected so they don't attend school while infectious. It's another tool in our toolbox. So, what? There's no data to back this up. Nothing that I've seen that says, yes, this is something we have to do. It's something we have to be worried about. There haven't been lots of school outbreaks. Until they started asymptomatic testing, there weren't cases in the schools. Right? So what is this? Why are people advocating for this garbage? Why are people advocating for this trauma for kids? Right? Like it's unbelievable. Why would you do that to your children? Right now, back to this, when schools in Ontario are identified for asymptomatic testing, parents receive a long-winded and technical email about paperwork, registration, location, date, and times. The testing is done off-site, evening and weekends, and they are still using NP swabs. Making this difficult means people are not going to do it. In a recent example I heard about, multiple schools were contacted about participating in asymptomatic testing on a weeknight at a high school 15 to 20 minutes away. Close to 2,000 students were eligible, 10 appointments made. Thank goodness. Don't fall for this ridiculous garbage. Don't waste your time. Back to this. Amy Greer says, we should be making this process easy. Bring non-invasive testing to schools, saliva or self-swab of the throat or nose, or send swabs home with kids like MGH has been doing this whole time. Drop specimen off for lab pickup the next day, and explain to families why it's important for supporting school safety and that they will be supported if a positive test is identified. The only way this works is if we have good uptake, and uptake will be poor if we keep doing it the way it's being done now. Listen, if you go and have an asymptomatic test and your kid is positive, guess what you win? You win 14 days at home. 14 days at home. You can't go to work. You're not allowed to go to work. So voluntary asymptomatic testing as a slow uptake? Shocking. Oh my goodness. I can't believe my surprise. Like, what did you think was going to happen? What did your model say was going to happen? Did you model this out? If people win imprisonment for 2 weeks if their kid happens to test positive. You know, if it is a very poor idea to to do this. This is like the stupidest way to manage a crisis I've ever seen in my entire life. What an idiotic thing to do. This is dumb too. This is stupid. Dufferin Peel Catholic School Board. I'm glad I don't work at school boards anymore. This is just insanity. And I believe that it is coming from a place of they want to do good, okay? But doing good and looking like in Oliver Twist, there's the guy who runs the orphanage, right? And he's got the gruel, and he's going to give the gruel to the kids, and like a malevolent warden, right? Like, yes, you can have a little more gruel today. You've been good, right? Like you can have a little more air today. You've earned it, right? You can take your mask off today. You've earned it a little bit. You can have a 5-minute break where you sit alone by yourself, being mindful about how crazy the world has become. Is this what we want to do to our kids? Okay. Recent changes to mask requirements mandates students without mask exemptions in kindergarten to grade 8 are to wear a mask at all times during the day, including when they are arriving to and exiting from school during outdoor breaks. Mask breaks are currently occurring when students are eating or drinking during snack or lunch times. In an effort to increase the opportunity for mask breaks, teachers should permit the students within their cohorts to have a mask break outdoors for up to 5 minutes, provided all of the following conditions are met. Students and staff are at least 2 meters apart from one another. Students and staff remain in the same place for the duration of the break. The duration of the break is up to 5 minutes. Teachers can also remove their masks during the break. During this time, students are encouraged to engage in mindfulness exercises. It is imperative that distancing is always maintained during the mask breaks. Should an emergency occur requiring a response where distancing cannot be maintained, masks are to immediately be worn before proceeding. Put your mask on before anything else. Doesn't matter what the emergency is. It just seems so wrong-headed. It seems like, and I talk about this a lot, and Lindsay, the Dr. Lindsay, I think he is, was talking about the same thing, the redirection of focus and the redirection of resources away from something that you should be focusing on to something like racism, right? Or whatever, right? Something that is not necessarily impacting a large majority of people when there are things that are impacting a large majority of people, right? Okay. Dan Kelly says, as of today, moving into lockdowns. As of today, Toronto businesses have been closed for most of the past year. Nail, hair salons, 206 days. Gyms, 278 days. Indoor dining, 287 days. And yet many officials are telling them just a couple more weeks to flatten the curve for a nation. We need a new plan on Friday. On Friday? Okay. Well, we've got a deadline for Dan Kelly. It's Wednesday, so maybe by Friday something happens. I don't know what Dan Kelly is planning, but he's planning something. He says, as further evidence of the impact of the pandemic on small businesses, I can report that CFIB now represents 95,000 members, down from 110,000 pre-pandemic. This is the largest drop in our 50-year history. As we seek to renew our members, a huge number are no longer there. Others are not in the position to pay a membership fee. One of the decisions of which I am most proud was our call to continue to provide free services to any CFIB member who can no longer afford to pay a membership fee. We also have offered free service to all independently owned businesses who need our help. We've had unprecedented demand for our services, including 78,000 calls for personalized help in 2020. Fortunately, we remain in a position to continue to serve all entrepreneurs. If you need our help, please use our toll-free introductory membership offer. I'd love your paid membership, but if you can't, I'm committed to providing our entire suite of membership benefits to all independent Canadian businesses until the pandemic is over. I think that it's interesting that he's been advocating basically the government line for the whole time, like just 2 more weeks, man. And now we're at a position where he's lost a lot of people who are no longer able to pay or just don't exist anymore. And how does that translate into, not we're doing good work, but like we need drastic change. Like we can't just keep this up. This is gutting. Like this is just gut wrenching here. This is Blog Tio, and I've got a photo journal to go through here. But JP Luisi says, I was born and raised in Toronto. I lived in the GTA until I was 48 years old. Last year I left for good. It looks like I made the right decision. I used to go up to Toronto every Sunday to visit my grandma, and we'd visit my aunt and uncle and my cousins. And we used to walk down the street, and like I remember Bayview being, we lived in Guelph, and in the 80s, like Guelph had Mark's Work Warehouse and Stone Road Mall, which was good. Like it was a good shopping thing, and downtown Guelph was great. I remember going with my mom, but it wasn't like flashy like Bayview. Bayview had like video game stores and all sorts of crazy toy stores and bike stores, and so we'd go and we'd walk down Bayview with my grandparents, and They just lived down the street from there, and it was like a magical place, kind of. And I guess I was a kid, so kids view, right? Toronto in the 80s is probably not so magical. But even in the 90s, I went down to Queen Street with my friends, like my teenage friends, and we'd hang out on Queen Street, and it was just as amazing because of, I mean, like the condom store, which, you know, was kind of funny because I was a teenager, but like the music store that I'd never seen. Not necessarily vinyl, because Guelph's a very musical town, but there was just something different about shopping on Queen Street than there was shopping in Guelph back then. And now it's just all shuttered, right? It's just shuttered. It's just closed. There's no coming back from this in a way that's going to maintain what was. Like what was is gone, and that's so unfortunate, right? This is a Toronto photographer. This is a photojournal. And links in the description. It's the scenicphoto.com. And this is just pictures of Toronto, right? Like Gus the Barber. Established February 22nd. I didn't see when that was. Is there a bigger one? No. I wish the year was there. But, right? Like we're talking long-standing businesses that have made money and been cared for and grown by families, and now they're just done. Now it's not worth opening because they're just going to be shut down. They're jerked around by the bad policies that we've allowed to take over, and there's nothing we can do about it. My goodness, I'm already really long today. Business may one day reopen, but the willingness by officials to overreach and clamp down on our personal freedoms will remain to some degree. That is just human nature, and we are letting it happen. Agar doesn't agree that he's part of the problem. He was against protesting at Ford Nation's home. Said it crossed the line. Well, Jerry, government has crossed the line and continues to, and your passiveness is also letting it happen. Never forget that. So he's responding to Jerry saying that we're letting it happen, or Canadians are letting it happen. Not me, but you. Here we go. Why is Toronto the most locked down city in North America? Why is Canada more locked down than many other jurisdictions across the globe, and in particular the United States? To compare ourselves with our southern neighbor, could it come down to our collectively different attitudes towards balancing safety with freedom? For many, perhaps most people in the United States, freedom is paramount, but with it comes a greater degree of acceptance of personal responsibility. Don't tell me I have to close my business for a year is the attitude. I will live my life, you live yours, and what comes, comes. That's the American way. They tend to gravitate more towards the idea that you need to know the risks for yourself and make responsible choices. If those choices don't work out, that's on you. Feedback to my radio show indicates that a lot of Canadians have the attitude that most people are not as smart as they are, so they support politicians who treat people like idiots. I thought these 3 paragraphs I thought were pretty devastating, and I think bang on, which is unfortunate but true. Politicians in Canada can get away with a greater degree of ordering people around, even ordering them into unemployment and bankruptcy, because most Canadians will put up with it. Sure, we have our anti-maskers and our rogue restaurant owners, the occasional kerfuffle at the airport, but politicians know they're unlikely to suffer in the next election. Small business owners are outvoted by fearful people in the public sector. Perhaps neither of these choices, freedom versus lockdown, is inherently better than the other in the long run, but they are certainly different. Unemployment in the United States is much lower. Mental health and mental health resources are breaking in Canada. Many Canadians will see that as a result, and see that result as an acceptable consequence of our doing what was needed for the collective good. Of course, the people making the decisions as to who will suffer for the collective good never seem to pick themselves. That is the near universal quality of political leadership, one that has been adopted lately by health authorities wielding their newfound power in Canada. It's not universal. Donald Trump didn't take a paycheck. I think that's interesting because there's a lot of politicians who would continue to enrich themselves fully, but there are some, right? There are some. It's not universal. It's near universal. There are some outliers. Anyway, back to this. That Canadian attitude of rules over anything else is demonstrated in public reaction to a rule mandating that churches, even with the capacity of 1,000 worshippers, could only have 10. No matter the size of the facility, the rule was 10. 10 indoors. Disregarding the total ridiculousness of such a rule, many Canadians backed it up for no better reason than that's the rule. Perhaps you believe that Canada, and specifically Toronto, which seems leads the planet on hardcore closing of businesses right now, is the best way to go. But I fear that freedoms lost are not easily regained. Power gained by politicians and others is not easily relinquished. Businesses may one day reopen, but the willingness by officials to overreach and clamp down on our personal freedoms will remain to some degree. That's just human nature, and we are letting it happen. He includes himself. He says we. He says we, not you. Not you, cowardly Canadians. You spineless Canadians. He says we. Us, spineless Canadians. All of us. And it's unfortunate because the people who want to fight, how do you fight? Because anytime you get together, anytime you gather, anytime you identify yourself as a group who's worth identifying with numbers worth noticing, you will be painted as white supremacists, and you will be backhandedly called terrorists, directly called racists, and you will be dealt with by increased police scrutiny of your actions and increased, uncomfortable things happening for you and potentially your family. Charlie Angus had yesterday, he deleted it, but there was a tweet stream yesterday, and I should have taken a picture, but he said that there were threats, people posting pictures of his children, and I thought, wow, that's pretty wild in Canadian politics. Shamed I didn't take a picture of it, but anyway, carrying on. That's the kind of stuff that does happen, right? This is no game. Anyway, Ryan O'Connor says this is the first known time during the pandemic that pickleball as a sport has been specifically targeted for greater restrictions in Ontario. Even in shutdown zones, outdoor pickleball is permitted and has always been permitted since color zones were introduced last autumn. And here he is, Ryan O'Connor, responding to his own tweet. He says, so the medical officer of health of Leeds, Granville, and Lanark counties has just instituted a class order banning team sports and closing down indoor sports venues, which are otherwise legal in the yellow zone. Did Ontario's pickleball lobbyist retire? Makes no sense. And it's interesting because here is Brian Lilly question about sports to Doug Ford. The problem is, one of the many problems is, there is no metrics to use. There's nothing to say, we're in this, we have to be in this. All these laws are like a la carte, like fly by the seat of your pants, like Lambada code, right? Like this one works right now just because I need this to work right now, and I'll figure out how to program this later. I'll figure out how to get this into law later, but we need you all to wear masks, regardless of it being a good idea. I'll get it into law later. I need you all to stop playing sports. We'll figure it out later, right? And here's a perfect example. So like places in yellow and green should have sports, but they're not. Here's Doug Ford responding to a question by Brian Lilly.
Given the benefits of summer sports, and the provinces like British Columbia have never shut it down, is it time for Ontario to take a different look and say that there's evidence that this is safe and also beneficial to young people in terms of physical activity, mental health, and all the other benefits, and move forward with allowing youth sports instead of keeping kids shut down inside?
Yeah, you know something, Brian, good point. I'll tell you myself, I coached my girls' soccer for years and years, and it's great to get out there and get the kids out there getting exercise, understanding teamwork as a team. There's so many benefits to it, but I'll be very frank, I got to get the green light from Dr. Williams and the local medical officers of health. As if there's a zone that are in the green, in the yellow, and the local medical officer wants to open it up there, then God bless him or her to open it up. But as we're here in Toronto and we're still in...
So I just think it's weird, right? Like he doesn't have a say. He can't make the rules about it. If they're in yellow and green and the medical officer of health wants to open it up, okay. But if the medical officer of health says, hey, no pickleball, buddy, no pickleball. Right, unless you're Mayor Brown, and then you can play your hockey with your buddies. We'll get these rebel guys out of here, right? I'm a small business owner, says Chloe, not a doctor. I have zero responsibility to enforce medical recommendations on clients or monitor their health. I have zero medical authority over their persons, and likewise, I do not consent to medical advice treatment from other small business owners. I would put that on my door. I'd say, there you go, checkmate, guys. # super straight. The Highwire. WHO meets to discuss AstraZeneca vaccine as more EU countries, Cyprus, Luxembourg, Latvia, and Sweden, halt rollout. This is 16 hours ago. I feel like talking about that's worthwhile. Mentioning that, right? Here's Dr. Kaur, and she says, how much does each vaccine cost the taxpayer? Break it down. Price of the vaccine from pharma. Price of storing and distribution. Price paid to whoever assesses, gains consent, and injects. Price of follow-up, studies, side effects, and benefits. Follow the money. We have 32,000 pharmacies ready to start immunizing Ontarians, but first we need the vaccines. If each pharmacy administers 100 vaccines a day, and that's being modest, that's an additional 3,200 320,000 vaccines in arms each day. It's all hands on decks, but we need the vaccines. So, and it doesn't seem to matter where the vaccines come from. They don't care about that. Ford says new recommendations for AstraZeneca vaccine messes everything up. He says, we had ideas. We just needed vaccines. You gave us vaccines, and now you changed the name or the ages of people. I think it's totally irresponsible for Canada to have a body that recommends dosing people outside of the recommended manufacturer dose. And I think it's irresponsible to have them recommend AstraZeneca to people who are above 65. I think this is horribly irresponsible. This isn't going to end well. This isn't a good idea. Like, who would do this? If this wasn't the government, if this was just a business, if this was Microsoft or another big business that was doing this, people would have lawsuits flying all over the place. But because it's the government, I don't understand. People aren't upset about this. I can't imagine it. I can't imagine people are just like, yeah, it's cool. It's cool. Here's another one. Not going to happen. Not my kids. At this point in Canada, no vaccines have been approved for use in children younger than 16 of age. Moderna begins testing COVID-19 vaccine on young children. The study intends to enroll 6,750 kids in the United States and Canada. Why would you do that to your kid? Why would you do that to your kid? Oh, I ran out of this one. Had to refresh, so we won't talk about that one, I suppose. The other day I talked about a poll out in Alberta that put the NDP at 50% or something like that, an 18-point climb, and Kenny had a 30-point reduction to 25 points, 25% support. And so the Wild Rose Party of Alberta says Jason Kenney just said he would actively campaign against any Citizens Initiative referendum supporting Alberta independence. If you're interested in Alberta independence, the UCP government will be fighting against you. So that's interesting, right? That's interesting stuff. There's lots of electioneering. This is 24 seconds of a senator, and I'll present it without comment. This is Kim. Oh, I'm going to get her name terribly wrong, I'm sure. Hold on. Here we go.
Do you know what a senator is? The Senate is one of two houses of Parliament. It's also known as the Chamber of Sober Second Thought. Senators have a responsibility to review all laws to ensure that they don't negatively impact the most marginalized in Canada. Racialized and Indigenous people, people living with disabilities, people living in poverty, people in prisons. Do you still think the Senate should be elected? Hi, I'm Senator Kim Pate. Please follow along for more conversations about Canadian politics.
Is that the job of a senator? Okay, I had to comment a little bit. All right, that's it. That's the end of the show today. We're already long, so I'll leave it here. Here are the Muppets. I can't play this because then the YouTube will get angry. Danny Boy is a terribly sad song. It's a terribly, terribly sad song. And so at the end, when Animal and they're all crying and they're saying, "Oh Danny Boy, oh Danny Boy," it's such a sad song. So you got to have a smile or two on St. Patrick's Day. Poor animal. Oh, poor animal. Okay, so you could also listen to Irish Eyes Are Smiling. Okay, have a happy St. Patrick's Day. Don't drink too much, and stay safe out there. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. Greg and I talked about, we got together yesterday and we talked about Super Straight and we talked about COVID because those are the two big stories. So if you weren't sure what I was talking about with the Super Straight hashtag, go check that out because that's what I was referring to. Anyway, have a wonderful, wonderful